Hi everybody, welcome to today's COVID video. This is April 9th and I've got a kind of a hodgepodge of things we're going to talk about today. First of all, as I do every day, my temperature is 96 degrees Fahrenheit, which is 35.6 Celsius. One piece of good news today, and this is probably the best news I've heard in a long time, is that the number of hospitalizations are nearly flat, and flat cases is fabulous in New York City. And that is really good news. That means that that's good news for all the people at the front line who are trying to fight these battles. The deaths are not down yet, but of course hospitalizations declines will precede the deaths. So I think that there is good news coming from New York as well as a number of places. One of the stories that I've been following is that we are seeing demographic differences. We are seeing different populations going on. Different populations are getting hit harder than other populations. African American populations are seeing the worst effects of this, and I think that has to do with a lot of things, underlying conditions and general access to healthcare in general. And that's something that we're following, and it seems to be an issue here and in the Native American population and a few other different populations, Hispanic populations. You see people who are exposed a little bit more. There's also a lot more cases in places like New York. We know that New York low-level infection had been going on for a long time, just like there was in Ohio as well, low-level infections. Also, it's hard to think about anything but yourself when things are bad right now, but it's just not bad here, it's bad elsewhere. So as we scramble for supplies, so do other countries scramble for supplies, and for them it may not they may not be as successful. So people are. This is truly a pandemic. It was a pandemic long before it was called a pandemic. So it is something that we need to think about in treating and worrying about in a long way. This is, I'm not quite up to date on this particular data here, but I'll show you something that, it looks a lot flatter for some of these other counties than Cuyahoga. This only goes to April 2nd, and this is like now a little bit old. So the effects of the leveling off you may not see for a while. Why is Cuyahoga County hit so hard? Well, there's more population. There is more population means more opportunity for a virus to bounce between one person to another person to another person. So, and the virus, quite frankly, seeded here earlier than it did in other outlying areas. But again, I think one of the great things I can say is that we're getting there. I want to give you some real good news is that, I've been a vaccine developer working on vaccines for most of my life, and I've never seen anything like this. This is amazing, amazing thing that's going on right now that people are working hard. There's like 78 vaccines that are in development, and there is 5 which are in clinical trials right now. And so if we get that going, we get expanded and it does work, and we have to look and see if the vaccine itself causes problems. This is not just a why can't we do this faster? It is not easy to do this any faster than we are doing. And there are all sorts of types of vaccines, live attenuated, inactivated, heat inactivated, or chemically inactivated, where you've got a different vector, where you're just in one of the vaccines is where they're just taking RNA from the virus, from the spike protein, the viral receptor binding protein, and they're coating it with fat and shoving that in to see if you can make a response to it and then make antibodies to it and make a protection. for it. So I'm kind of excited about that. I am impressed by the speed. One thing I want to do is, you say, why aren't we doing this faster? We need to support this kind of work. And we need to even support some vaccines that won't work out, because we need people doing this kind of work. That's an important thing. That's one of the things that Bill Gates is doing right now. He is supporting vaccine work even if it doesn't pan out. And that's an important thing, because people have to buy things, and if they're unsuccessful, they're in bad shape. I want to finish with one story. I have all kinds of students who are working in the healthcare system, and with all kinds of scary stories. And there is shortage of all sorts of personal protection. I ran across a paper yesterday in the New England Journal of Medicine, and it also had a video. So this is a screen capture off of the video, so that's why there's those little 2 bars in the middle of that. And there's a shortage. That's just the first slide here. But they were able to manufacture a really cool kind of a thing. First of all, in the upper left corner, you can see a guy getting, basically, when a trach tube fails, he gets blown with they used a mannequin, they used a model here, and they put some fluorescent dye in the lungs, and then when the dye was released, he got it covered all over himself. And so they decided to come up with the design of a little box, just plexiglass, just a couple of pieces of plexiglass with a couple of armholes built into it. You can see that on the bottom left-hand corner. And you can see one of the doctors in the study, and he is standing behind a patient, putting his hands through the glove box. Now, if this trach tube were to fail on this individual, his hands and arms would get covered, but his face mask, you can see in the upper left-hand corner, the face mask got covered with the fluorescent dye, and only thing would happen is his hands would be non-sterile. And I think that is the kind of thing, the ingenuity that is going to make life better for a lot of people working in a very, very dangerous place. And then the plexiglass, of course, can be just cleaned with some sort of a detergent and reused, which is, I just want to point out that there are some good things going on out there. I'm going to stop right there, and thank you all for tuning in again. I want to remind you to be one of the helpers, and staying home is to be a helper, and it's working, and you need to keep on doing it, unfortunately, because we have to make sure that not only do we not have virus circulating anymore, we have to make sure that the virus that exists is gone too. Viruses can't last any longer than there's hosts. They're an obligate intercellular parasite. They require a host, and as soon as there's no hosts available, wherever they are, if they're in their living room, not available. If they're in the grave, they're not available. Or if they're immune, they're not available. We need to make this virus, we need to be unavailable to the virus right now. And if we can get through that and get through a few more days, a few more weeks after that, at that point, then we've beaten it. And I'm very confident that we need to make sure that the vaccine work continues, so that we can not have to talk about reemerging virus later on. So we need to keep that funded. So cheerfully pay your taxes. Those of you who pay taxes, cheerfully pay your taxes to make sure that work gets funded, because that's important work for all of us going forward. It will save us money. Healthcare saves you money. Spending on healthcare saves you money in the long run, because you prevent all the misery that occurs, like what we're seeing right now. All right, I'm going to stop right there. Just remember to be good to yourselves, be good to each other, and may you persist like a lentivirus. Thank you.